Here's a story that is giving hope to millions of Americans. More people are surviving cancer than ever before, according to a new report from the American Cancer Society. So I talked to a local cancer doctor who says this is a great start, but there's still so much work to do. It's impressive news coming from the American Cancer Society. The risk of dying from cancer in the United States has dropped 32% over the past 28 years.
So that means that over the last 3 decades, at least today, we have 3.5 million less deaths. So that's a significant amount of people that have not died from cancer. And we can celebrate that.
Dr. Stella Mari Rodriguez is a lung cancer expert at the University of Miami's Sylvester Comprehensive Cancer Center. Factors such as early detection, treatments, new technologies contributed to the decline. And when it comes to our state,
so Florida has the second largest burden of cancer in the United States. And in Florida, we still see that lung cancer rates are going down, but they're still very high.
And she said that is in large part to Florida's older population. Dr. Rodriguez reports breast cancer rates are rising in our state, but less women are dying. And when it comes to children and young adults, kids have really benefited from new technology in the fight against cancer. Cancer death rates have dropped 60 to 70% since the 70s, but there is still work to be done, so much of it. The news is encouraging, but the disparities still exist. Cancer survival rates are lower for Black people than for white in almost any cancer type.
So that is really striking because if we look at breast cancer, which is the most common cancer death for women, Black women are 41% more likely to die than white women. So we need to understand why is that. Is it risk factors like obesity? Is it genetics? But also for Black men are more 2 to 4 times more likely to die from prostate cancer than white men. And that is seen across the board. So we have a lot of work to do.
Racial, ethnic, socioeconomic disparities have long been an issue, keeping people from accessing quality health care and prevention. Because while the cancer death rates are improving, it's really about preventing the diseases altogether. And doctors want to remind us that we can do so by watching our diets, exercising, knowing our family history.